During my objective assessment, I have to identify whether or not there are any muscle imbalances that may be present. To help explain these muscle imbalances, we need to understand that the body is a series of alternating joints, moving from mobile joint to stable joint, mobile joint to stable joint. If a mobile joint does not move as much as it needs, excessive stress is going to be put through the stable joint, which means that that stable joint, which shouldn't be moving too much, starts to move far past what is expected of it. And that will lead to pain. For example, the ankle joint is very mobile. The knee joint, however, is very stable. The hip joint, very mobile. Low back should be very stable. Mid back should move and be a very mobile joint. The shoulder girdle, your shoulder blade, should be nice and stable to allow your mobile joint at the actual shoulder to move smoothly. Then your elbow is a very stable joint, and then your wrist is a mobile joint. A lot of the times when a patient comes to me with pain, they have a muscle imbalance that leads to their problem. For example, low back pain. The low back is a very stable joint. It shouldn't move very much, but the hip is a very mobile joint. It should move very easily throughout a large range of motion. Most people have exceptionally tight hips and lack of support at the abdominal region to help support your spine. So your hips aren't moving enough and your low back is moving too much. Right there, there's that muscle imbalance. The hips are too stable, the low back is too mobile. Whenever a patient has pain, I look at every joint involved with that region and identify whether or not the stable joint is moving too much or if the mobile joint is moving too little. At that point, once you identify the joints that aren't working the way that they need, then you apply the appropriate soft tissue techniques to help break down the tight muscle and then stretch it out so that then that mobile joint starts moving better. And then you actually want to focus on stability of the stable joints to help allow for the appropriate muscle balance to be corrected.